The White House names a new director to coordinate the federal response to monkeypox. Here to answer your questions is Dr. Helen Boucher, the interim dean of Tufts Medical School and an infectious disease specialist at Tufts Medical Center. As always, thanks for joining us, Dr. Boucher.
Good to see you, Erica.
All right, Dr. Boucher, as you well know, case numbers have been rising here in Massachusetts and many other states. The CDC now confirms more than 5,800 cases in this country. So in your opinion, has the monkeypox outbreak now become a national emergency?
Well, Ben, I think it's really important that everybody knows about monkeypox. It's spread across the country, and it's important for physicians as well as our population to understand that this infection exists and to be vigilant, especially if you're in one of the risk groups.
Well, here in Massachusetts, health officials have identified 134 cases of monkeypox so far. If you suspect a patient at Tufts may be infected, for example, what steps are taken to confirm it is in fact monkeypox? And then what's the treatment?
Well, Erica, there are tests available for monkeypox that we send off. And in many cases, specific treatment isn't needed. It's what we call supportive treatment mostly for pain associated with this illness. If treatment is indicated for severe infection or in people who have immunocompromised or other risk factors, we work with our colleagues at the Department of Public Health to think about accessing an investigational therapy and perhaps using some other less conventional therapies.
All right, let's talk about vaccines, something that we've all kind of become intimately familiar with over the last couple of years, albeit for COVID. But there are vaccines available for monkeypox, but right now the CDC is limiting those shots to people who have either been exposed or have certain risk factors. Why are they doing that? Why don't they scale this up and give a dose to anybody who wants one?
Well, right now we have a supply issue, Ben. So the vaccine, as you mentioned, is being indicated for people who've been exposed or are at high risk. And the hope is that we'll have more doses soon and be able to use it more widely. Of course, we hope the virus doesn't spread to the effect that we would need it, but plans are underway to ensure that we have a better supply soon.
Well, so we've received some emails asking if the chickenpox or shingles vaccines provide any protection against monkeypox. So what do you say to those questions?
Yeah, this is important. So the shingles is caused by the same virus that causes chickenpox, and that is called varicella, and that's different from the virus that causes monkeypox. It's actually a relative of smallpox. So two different viral families, and there's no protection from chickenpox or shingles vaccine against monkeypox.
And the same thing, so you wouldn't have any immunity if you had shingles or chickenpox, right?
That's correct.
Okay. All right, Dr. Helen Boucher at Tufts Medical Center, thanks for your time. Good to see you.
Yeah, thank you, doctor.
Good to see you.
And to our viewers, if you've got questions you'd like our experts to answer, you can email them to ask@wcvb.com.